I'm Vijay Singh. I'm the Vice President of Research and Development here at HealthrackRx. Brief introduction to who we are. HealthrackRx is a diagnostic solutions company, and our main focus is PCR-based molecular tests for a variety of syndromes related to respiratory, urinary tract, sexually transmitted diseases, and many other specialities. And we have a nationwide presence, coast to coast. We have 4 labs wherein we are, for almost 20 years now, we are enabling accurate clinical decisions for our providers through our molecular testing platform and advancement in pathogen detection and identification, and a unique leadership in antimicrobial stewardship. So what we had seen during the pandemic in 2021 was that there was a marked decrease due to the lockdown measures and the restrictions, overall travel restrictions. What we had observed was that there was, at least in the initial half of the year, there was a marked downturn in sample volume being tested for STIs. And but what was interesting, that towards the latter half, as the lockdown measures were eased, we started observing a very significant increase in STI instances. And since last year, I would say since 2022, the numbers seem to be more stable now. But as compared to the pre-pandemic baseline, which would be 2019, we are seeing a higher infection burden of sexually transmitted infections. So now the testing volume is more stable. What we are seeing is that there is an increased demand for chlamydia, gonorrhea, trichomonas, and to a certain extent, Mycoplasma genitalium testing. And what we have to be careful about is that, because we have a variety of expanded panels, we have to take care of these particular tests that are being ordered. So, like I said, the limited panel tests, and that was one of the big reasons that we have, now pivoted towards more targeted multiplex testing of these tests. One of the main points and that's true for any infectious disease, is that a diagnostic test, the main aim for any test is to provide a clear sense of clarity to the healthcare provider with respect to the patient's condition, and help them make better decisions with respect to patient care. And when it comes to molecular methods like PCR, there is a very clear advantage with respect to the sample throughput and the turnaround time, which can vary from a few minutes to 24 hours to the results, when one compares them to classical microbiology methods of culture and sensitivity, which in case of many sexually transmitted infections like chlamydia, gonorrhea, can take anywhere from 3 to 5 days. Our philosophy for designing any PCR panel is to provide the maximum information to the healthcare provider, and the mainstay or the main focus is on the symptoms that are being presented by the patient. So irrespective of the size of the panel, what we try to cover for are the most relevant pathogens that are responsible for that syndrome. And so if you look at the variety of panels that we have on our website, they can be categorized as urethritis, vaginitis, genital lesions, or high-risk sexual behavior. Again, like I said, the main idea of how we design our panels, it's based on the national and local infection trends, and then what is being published constantly in the literature. And the patient population that we serve, again, it's completely based on the syndrome or the symptoms being presented. I'll give you a recent example, which was the non-endemic outbreak of Mpox this year. And what we had done was that we pivoted very quickly towards developing our own PCR-based Mpox test in response to this public health emergency. And not just the non-endemic outbreak, but the nature in which this infection was spreading, which was sexually. And as that became clear, the Mpox test is now a part of our genital lesion panel. The use of a targeted or an expanded panel is for us, and should be for others also, based entirely on the symptomology of the patient and the patient setting that one is targeting. So a targeted or a small panel menu would make more sense speaking with respect to STIs, where one is seeing a high-risk sexual behavior, say, as opposed to a hospitalized patient, where a more expanded menu would make more sense. And so again, I would always enforce our basic philosophy of looking at the symptomatic patients. So with respect to that, the multiplexed STI testing that which allows for high throughput within the lab, it allows for a very quick turnaround time to results, and with 3 to 5 assays within the same PCR well, it allows for the lab to conserve resources, both with respect to the cost or the economics of the cost and the time. And one is able to provide really high quality and relevant results to the physicians and the patients. My advice to any lab that is looking at either introducing these targeted STI tests or expanding their existing capabilities is to always keep in mind the patient population or the client base they intend to serve, right? And what one has to keep in mind is to strike a very delicate balance between the science that is being done and the economics of running those tests in the lab. So in that very scenario, the targeted STI panel, especially a multiplex PCR assay, can be a valuable resource when it comes to reducing the overall costs to the lab of running that test and the overall economic burden with respect to both time and the highly specialized labor that is involved.